Yeah, we spoke a few times.
Oh yeah, I've been at meetings. Hello, welcome. Small group, but it's always on 11 o'clock on a Wednesday morning in downtown Wilkes-Barre. I'm Roxanne Pauline. I'm one of the volunteers with HCAN, and I'd like to welcome everybody and thank all the labor for coming out today. The reason that we've gathered here today is to solidify healthcare reform in our communities and throughout the nation. What we have happening is an ad that HCAN has put out in key states throughout the country, trying to entice these senators that are not on board to sit down and have sound discussions with us regarding the healthcare reform. Healthcare reform will happen. It's just a very complicated issue, and it's going to take a lot of time in order to expedite this mission. It's a long road that we have. Most of us have been working on this for a very, very long time. The ad that we have running today throughout the nation, I have copies in the media kit to give to the media, and we were expecting a FedEx delivery of the actual DVD so we could show it. But it's indicating that it is now time for healthcare reform. Move On also has an ad running simultaneously with that, a little more humorous in message, but we're trying to get everybody, all the senators and all the representatives, to get on board and really start discussing. We all know the story going on with Senator Specter today, or this recently, and now that he's come over to the Democratic side, we got him to sign a paper last week that said that he will be involved in sitting down and openly discussing this program with us. Prior to that, he's been a little bit iffy on the entire healthcare issue, and we couldn't expect probably anything else. We're looking forward to those conversations. We're looking forward to everything that's about to go on. And the key here is that we need to get people out and people involved. The reason these groups here, when we do rallies or we do events, are so small is because the sick people can't get out. We have Betty Ann Clark that came today, and she has, as everybody does, a healthcare story. It's very difficult to get these people out to speak for themselves. And the issues being so complicated, sometimes they're really not sure exactly what it is they're talking about. We have very, very strong union support, and I thank you guys wholeheartedly for coming out all the time and doing everything you can. And I like to get a couple of you to speak, and some of them are a little bit camera shy. But we have Sam Bianca from Wilkes-Barre Labor, who is an icon here. We have George from the Letter Carriers Union, Branch 115. We have Ken, I'm going to murder this name, Karasik?
That's very good.
Correct, right. UFCW 1776. And Gil Kuhn, a UFCW. And Alex from Unite. So we're all here, and we are behind us. There's 100 people. So don't let the crowd scare you. When you look at me, you can see 100 people. But there's 100 people behind all of us here, and the petitions, the letters, the phone calls, particularly right now to our representatives here in this state, are very, very important. It's important that we get the message out to everybody to say reform is going to happen, and we need to make it happen now. We can talk this issue until we're blue in the face, and it's not going to make any change until we take hold of it and make that change happen now. I hope that makes some kind of sense. I'm going to introduce you to Don Knowles, and Don is a concerned community activist who's been working on a lot of different programs with us. He has a lot of good information with healthcare, and I just want to give you some volunteers. And Don, where are you? There he is. Okay, Don Knowles.
Good morning. I'm from the Scranton area, and for some time have been very interested in the whole issue of healthcare reform. I think most, if not all, of the important bits of information about why we need to reform this fractured, unsustainable healthcare system, they've already been made. We know now that our country has approximately 50 million uninsured people, and many, many more that are underinsured. We know that per capita we we spend probably twice as much as any of the other countries in the industrialized world who have and have had for some time national health care systems. And so most, if not, as I said, of all of the arguments as to why we need to do something with healthcare reform now have already been made. It's just a question of what we're going to do and how we're going to approach this so that we finally get some fundamental reform and not another kind of fractured reform which down the road will then have to be repaired again. I noted with some interest this morning in the Scranton Times there was an article on the first page, and the Secretary of the Treasury, Geithner, made the comment that it was going to be essential to reform Medicare and Social Security, and that in fact the issue with Medicare was going to be, the unsustainability of Medicare was going to be upon us much sooner than they thought. And I believe that's indicative of what is wrong with some of the approaches that have been taken to healthcare reform. For example, he's talking about reforming Medicare, but it's not the Medicare system that's broken. It's essentially our entire healthcare system that's broken. And so we have these fragments. We have many groups that are insured, and then we also have veterans, and these are all fine programs. The Veterans Administration and Medicaid and Medicare and thousands of private insurance companies throughout the country. And so this is the kind of fractured system that we cannot have, and that's why I think that while Secretary Geithner made the important point about the need to reform Medicare, that in fact we have to begin to think in terms of reforming the entire healthcare system. One of the things that I think is important to say, because it has come up frequently, is this whole idea that somehow with public funds we have to guarantee private profit. I certainly not, and I don't think any of us are opposed to profit. We are not. But in this situation, we're talking about using public funds to guarantee private insurance. And the reason I think that point is important to make now is because there is a great debate going on, and hopefully will continue, about the importance of this publicly offered plan. And the response to that is that private insurance doesn't want to compete with this public plan. I don't like to really refer to it as a public plan or a government plan. I think of it in terms of, since we're paying for it, a people's plan. This is a people's plan that we're talking about. And so in the spirit of competition, I think it's really important to emphasize that it's going to be very difficult to get this message across about the importance of reform unless there is this other option. And I think it's absolutely fundamentally important that we have this other option. And that's that option which says that we are going to have a public plan, and that people will be able to, if they choose, will be able to choose to get into that public plan. So with that, I think I can stop right there. I'm very glad that people have come out. I hope that we can continue to offer a very visible presence in Wilkes-Barre and Scranton as this argument goes forward, and that hopefully out of all of it will come a truly systemic reform of our healthcare system. Thanks very much.
Good job. Good job. Good job.